When I'm running through this example, you can start to think about who this person could be. Obviously, he likes football and he likes cars, judging by his t-shirt. But that's not a hint. This is I'm sharing with you the experiences here of a famous hospital in the UK called the Great Ormond Street Hospital for Children. They were very concerned about the amount of time it took and the problems that occurred when transferring patients from the operation theatre to the intensive care unit. Because they've done studies on this in the past, and they've found that this is an area of risk, because they're dealing with very young children who've often been through a very serious operation. Some operations may last for 8 hours. And so actually transferring that child after an operation from the operating theatre to the intensive care unit was putting that child potentially in danger. This slide here shows photographs from the actual hospital itself. And when a patient or a child is transferred from the operating theatre, they're first of all transferred onto some portable equipment and then to the intensive care unit. And really, I say this is an accident waiting to happen, because in a very short space of time, those people who've been operating on the child need to transfer the information about the child's condition to the staff who work in the intensive care unit. And not only that, there's this equipment transfer where there's lots of leads and wires, and all the equipment needs to be running in a way that it's supposed to be running. So they're in a situation where equipment transfer can go wrong and information transfer can go wrong, which puts the child at risk. And it was after one particular operation, which again was quite a long operation, that two doctors went to the lounge to relax and switched on the television, and they were watching a Formula One race. This is all a true story. So watching Formula One on television, and they noticed that within a Formula One race, you have these pit stops. And at a pit stop, a 20-member crew changes the tyres, fills the fuel, clears the air intakes, and sends it off in only 7 seconds. And they do this in a way that is obviously very time efficient, but also the crew members themselves are not put in any danger through this sequence of events, and also the driver drives away quite safely. And they thought, well, what can they learn from this experience? Because the hospital's also involved in changeover. And so what those two doctors decided to do was to go to a Formula One race to watch the actual process in operation. And they decided to go to Italy because they contacted the Ferrari team. And the Ferrari team said not only would the doctors be their guests, but also they would show them in more detail what they actually do. And these are some of the things the doctors learned from that trip to Italy. That the routine in a pit stop is taken very seriously. What happens in a pit stop is predictable, so problems can be anticipated and procedures can be standardized. Crews practice those procedures until they can perform them perfectly, and everybody knows their job. But most importantly, only one person is in charge of the whole operation. But everybody knows their individual roles. When the doctors were getting this information from the pit stop crew, what they noticed was that the pit stop crew always are asking these sort of questions. What could possibly go wrong? What are we going to do if it does go wrong? And how important is it if it goes wrong? So the pit stop crew are very proactive. And they thought that's something that they could learn within the hospital. And The pit stop crew also used techniques like failure mode effects analysis to identify potential failures, to identify the severity of those failures should they occur, to identify the likelihood of those failures occurring and whether they're likely to detect those failures should they occur. So they used techniques like this to improve and improve until they got the time down to 7 seconds and they could undertake the pit stop in a safe manner. So they started taking these lessons on board. And not only that, they found so much out from this particular experience, they actually invited McLaren to actually come and provide advice to them. So they really started to take on board some of these lessons from Formula One. So I'll now share with you some of the solutions from that. What they did was develop a 12-page set of procedures showing clearly what each member of the team should do, therefore what each doctor should do, what was the role of the particular nurses when a changeover was occurring. So everybody clearly knew their role. They also assigned a leadership role to one person to oversee the whole changeover. And what they also did as well was they took on the expertise of a choreographer to show how the hospital staff should stand and how should they move within a space around them. And so this was all approach based on benchmarking, learning from the experience of others. And through the learning that they obtained, the result was they had a 70% reduction in equipment and information changeover errors, which is a huge improvement within a hospital. And more importantly, when you think about where the hospital, what the role of the hospital is, and that that is trying to improve the likelihood they're trying to improve the outcomes from a particular operation, the importance of this is major. I mean, this could affect somebody's life. So benchmarking not only reduces errors in this case, but what it also does, it changes the culture of an organization. Because what the doctors said after this particular benchmarking exercise is that the culture of the hospital started to change. They didn't just rest on their laurels. They didn't just say, well, this is the best procedures we can possibly have now. They wanted to get better still. And so benchmarking changes the culture of organizations. So organizations become more like an eagle. And so people start to focus on how can we get better. This is a photograph of the actual surgeons and doctors and nurses on an operation in the hospital. And this is the little boy that you saw earlier on. This is Matthew. And so he benefited from that benchmarking process. And you can see Lewis Hamilton, who was in Singapore quite recently for the Grand Prix here. So benchmarking is a powerful tool for improvement, and it can be used within any industry. Because prior to this experience, the hospitals might have been saying, well, benchmarking wasn't for us because we're in a highly regulated industry, but clearly it can be used. The other key learning here is that benchmarking is not about exchanging data. That's not the prime purpose of this. You do benchmarking to learn from the experience of others. Also, as you can see from this case, they were not interested in financial outcomes. It was more than that in this particular case. So benchmarking is not just about getting financial benefits. It can be also used to save people's lives.